All right, so what is disordered eating? Disordered eating falls on a spectrum where food is not an issue to an eating disorder. When food is not an issue, people don't have an issue with what they eat. They're not too concerned about what they eat, whether it's good or bad. They feel like they have a decent balance between good foods and bad foods, enough exercise and not enough exercise. And as you go further down the spectrum or the continuum, there's concern in a healthy way. There's food preoccupation slash being obsessed with food and always wanting to divide your foods from good to bad. And it goes all the way to being eating disorder where you worry about each and every little thing, the weight that you gain, things of that nature. With eating disorder is a psychiatric disorder characterized by severe disturbances in body image, eating behavior, and thoughts and the function of actual eating. A couple of different disorders, as defined by the American Psychiatric Association, is anorexia nervosa, bulimia nervosa, binge eating disorder, and then they have what they call OSFED, which are other specified feeding and eating disorders. In the United States, 10% or more of late adolescents and adult women report having some form or symptoms of eating disorders. So that means anywhere along that spectrum of other specified eating disorders or anorexia or bulimia or binge eating. In 2013, 2.1% of all college students reported dealing with either anorexia or bulimia. In the U and also it says in the US, men represent about 25% of anorexia and bulimia patients. Disordered eating is actually also very common amongst college athletes who perform in gymnastics, wrestling, things where their weight has to be managed. So the first eating disorder I want to discuss is anorexia nervosa. It is a persistent chronic eating disorder characterized by deliberate food restriction and severe life threatening weight loss. So it kind of involves self starvation motivated by fear of gaining weight. Also, along with it, becomes a distorted body image. So people who might not be all that big start to believe that they're a lot bigger than thought. It says an estimated 0.3% of females suffer from anorexia nervosa. The APA, the American Psychiatric Association, considers these as some of the criteria for anorexia: refusal to maintain body weight at a normal minimal for normal height, weight, and age at that height and weight, an intense fear of gaining weight or becoming fat, even though considered underweight by all medical criteria. And the final one is disturbance in the way in which one's body weight or shape is experienced, undue to influence of body weight or shape on self-evaluation, or denial of seriousness of current low body weight. So basically, they start to talk about the different somebody who is very already underweight still thinking that they're too big or too fat or things of that nature. So they feel like they need to starve themselves and to not eat in order to maintain a certain weight. Some of the physical symptoms are you have a little bit of alteration in like your bone density decreases, your muscle tissue is actually lost. Your skin can become dry and discolored a little bit, bruising. You might bruise a little bit easier. Your hair thins and brittles. Your blood level, the iron and the electrolytes in your blood go low. Kidney failure can be possible. Your immune system goes low. Your immune function decreases. And it also causes issues for reproduction with women. So those are a few different physical thoughts with it. There are different ways and different reasons that people do it. There's a lot of complex ways. Some people might do it because of social norms. Some people do it because of psychiatric issues that they might already have or family or friend pressure. Currently, the best way for them to do anything is to get treatment. psychologically on helping them restore a normal order to what they eat and how they eat. The next eating disorder I want to talk about is bulimia nervosa. Bulimia nervosa is an eating disorder in which a large quantity of food is consumed in a short period of time and is often followed by feelings of guilt or shame. Bulimia is typically a disorder that involves distortion of body image and obsessive desire to lose weight, in which people typically do extreme overeating and they follow it by depression, and self-induced vomiting, purging, or fasting. Up to 3% of adolescents and young women are bulimic. Rates among men are about 10% of the weight rates among women. A combination of genetic and environmental factors is thought to be the cause of bulimia. So things such as family history, a person or family being obese are things that are considered thought to be contributing towards bulimia. The APA criteria for bulimia includes recurrent episodes of binge eating and recurrent inappropriate compensatory behavior such as use of laxatives or diuretics, fasting, excessive exercise, or self-induced vomiting. All this in the sense of trying to lose whatever I just ate. Another part of their criteria is the behavior must occur at least once a week for 3 months. So something that typically continuously happens. That person continues to either purge or induce vomiting after eating a whole lot. Some of the things that can be physically seen on that person. So it causes depression, it causes anxiety, dizziness, potential seizuring. Your throats, your jaw, the glands around in your neck can become swollen from the constant vomiting. Your tooth enamel erodes, and you can potentially get cavities and things of that nature from the the acid coming back up. Your esophagus can also become inflamed or ruptured. The electrolytes in your blood levels fall dangerously low. You can have issues with your stomach, kidney malfunction, and the laxative abuse can cause issues with constipation and things of that nature. The last eating disorder we have binge eating disorder, which is a type of eating disorder that's characterized by gorging on food once a week or more, but not typically followed by the purge by purging your food, such as in with bulimia. Um, as in both of them, they're very similar. The episodes are characterized by eating large amounts of food rapidly, even when not hungry, and then ending up feeling guilty or depressed after overeating. The biggest difference between bulimia and binge eating, with binge eating, they don't purge, they don't try to force the vomit up afterwards. So they don't become as, they're concerned about body image, but not in the same particular way. The APA criteria for binge eating disorder are similar to those for bulimia, but without the compensatory behavior. The prevalence of binge eating is thought to be around 1.4%. Those diagnosed with binge eating disorder typically show three or more of the following behaviors. They eat much more rapidly than normal. They eat until uncomfortably full. They eat large amounts when not physically hungry. Eating alone typically is embarrassment over how much one is eating. And they also feel disgusted, depressed, or very guilty after overeating. Without treatment, approximately 20% of people with serious eating disorders will die from it. With treatment such as psychological help, help with eating habits and things of that nature, long-term full recovery rates range from 44% to 76%. As for my cure, we decided to call it RegulATE with play on words on 8 at the end of it. It is a phone app in part device similar to like a Fitbit that you will wear on your wrist. Some type of wearable device that would help send a signal to you that says, I haven't ate yet. So the thought process with it is whether you're overeating or undereating, people typically don't eat on schedule as they should. And even people who eat on schedule sometimes typically forget when they should. So what we would do is set up a signal with a silent alarm on something that's like what a Fitbit has on it, where I can basically set different times throughout the day where I should eat. So the alarm will go off for breakfast and a snack and lunch and afternoon snack and dinner, so on and so forth. With that being said, with the phone app, you can do what plenty of phone apps do currently, which is track what you ate, how many calories you ate, and see where you're at throughout the day. If you're trying to lose weight, if you're trying to maintain weight, if you're trying to gain weight, keep the caloric intake actually where it's at your hands and you know what you're eating, whether you're eating fast food or restaurant food or food that you cook yourself. Some of the benefits of a program like that is it helps you, it just gives you subtle reminders to make sure you're following what you want. Some of the disadvantages are is even though you have a phone app and everybody is attached to their phone, sometimes people will ignore the apps or you ignore messages that you have anyway in your face all day long. And some people will, even though they have the app and it's readily accessible, they will still ignore it. If they have the wearable device, sometimes you still don't put the wearable device on in order to pay attention enough to it. So while I think it's a great idea and it helps people keep track of what they're doing, you actually still have to have a little bit of wherewithal in order to put the device on and pay attention to the app that you have on your phone.